Hello, my name is Jessica Mendenhall, and this is my social justice presentation for Nursing 654. I live in Seattle, Washington, and more specifically, I live in Rainier Beach, which is a neighborhood. I decided to do a more focused study since Seattle as a whole is huge, and I wanted to be more specific. The social determinant of health that I've selected for this project is early life adversity. First off, what are social determinants of health? According to the CDC, social determinants of health are the non-medical factors that influence health outcomes. They are the most modifiable set of targets for interventions currently available to prevent the onset of mental health problems and disorders and to promote positive mental health in our populations. Some examples of social determinants of health include socioeconomic disadvantage, early life adversity, childhood adversity, ethno-racial discrimination, sexual orientation discrimination, neighborhood socioeconomic disadvantage, and physical environments. Why I chose this topic. We learned earlier in our program about epigenetics and how the health and well-being of the mother can have a great impact on the fetus and how that baby develops. Gene expression can be altered due to significant external factors such as nutrition, safety, substance use, and stressors. While it is not yet fully understood, there is growing data that continues to support the fact that early life exposures to stress, toxins, and other stimuli exert lifelong effects on neuropsychiatric development. Three of the major health issues that have been linked to epigenetics include schizophrenia, bipolar, and major depressive disorders, and this list continues to grow. According to the CDC, perinatal mental health issues are the leading cause of maternal mortality in the United States. It's virtually impossible to talk about one social determinant of health without discussing the overlap that exists between all of them. In particular, race and socioeconomic status play a huge part in the physical and mental well-being of a community. According to the American Psychiatric Association, racial and ethnic, gender, and sexual minorities often suffer from poorer health outcomes due to multiple factors, including inaccessibility of high-quality mental health care services, cultural stigma surrounding mental health care, discrimination, and an overall lack of awareness about mental health. Rainier Beach has a population of roughly 7,000 people, and data from 2019 showed the distribution of race as 55% African American, 20% Asian, 10% Caucasian, 10% Hispanic, and 5% from other races. According to Seattle.gov, compared to Seattle as a whole, Rainier Beach has 82% persons of color compared to 33%. 57.2% speak a language other than English at home compared to only 22%. Only 72% have a high school diploma compared to 93%. 26% have a bachelor's degree compared to 57%. And the unemployment rate in Rainier Beach is 12.2% compared to 7% for Seattle as a whole. Now, comparing this to the nation, the United States Census in 2023 has the population at 13.6% African American, 6.3% Asian, 58.9% Caucasian, 19.1% Hispanic, leaving about 2.1% for other races. 37.7% of Americans have their bachelor's degree, and 87% have a high school diploma. According to the U.S. Bureau of Labor and Statistics, the national rate of unemployment has averaged between 3.7 and 3.9% since August of 2023. When you look at these numbers, it becomes very obvious that Rainier Beach has a much higher rate of minorities and unemployment, and far fewer individuals have advanced degrees. This is important because racial and ethnic minorities tend to be underdiagnosed, misdiagnosed, and not receive adequate treatment. If the women in my community do not have appropriate access to care, suffer from mental health illnesses, have endured adverse childhood events, and face multiple stressors, then this increases their risk for perinatal issues and sets their children up to be vulnerable to a myriad of issues themselves. By not providing adequate care for pregnant women in our communities, we are perpetuating a generation of dysfunction and disease. This problem not only impacts women who are pregnant, but positions their future children to struggle and face potential hardships. The Center on the Developing Child at Harvard University has found that early experiences influence the developing brain. The prenatal period through the first year of life is critical because the brain undergoes its most rapid development, and early experiences dictate in part the architecture of how it will develop, either fragile or resilient. Healthy emotional and cognitive development is formed by responsive and dependable interactions with caregivers, and a lack of these qualities can disrupt normal brain development. Children who have suffered from neglect demonstrate far less brain activity than those who have not. The American Psychological Association found that minorities tend to face greater disparities in mental health care and have poorer outcomes. In a study by DeMorney et al., they state, early exposure to adversity, i.e. either threat or deprivation, is associated with structural alterations of brain regions, such as the prefrontal cortex, amygdala, and hippocampus, which support healthy emotional function in response to threat and stress. Therefore, racial disparities in childhood adversity may contribute to race-related differences in the structure of the PFC, hippocampus, and amygdala. As we have learned in this class about the ACE studies, adults with more adverse experiences in early childhood are more likely to have health problems, including alcoholism, depression, heart disease, and diabetes. The American Psychological Association found that women who reported more depression, stress, or anxiety while pregnant were more likely to have children with ADHD or who exhibited more aggressive and hostile behavior. This was true regardless of the gender of the child. One example of mental health issues for pregnant women and new mothers is perinatal depression, which is a serious but treatable medical illness involving feelings of extreme sadness, indifference, and/or anxiety, as well as changes in energy, sleep, and appetite. It carries risks for both the mother and the child. An estimated 1 in 7 women experience perinatal depression in this country. So what do we do? There are limited options for residents who live in Rainier Beach. While Seattle itself boasts numerous hospitals and medical networks like Swedish and UW, the closest hospital to people in Rainier Beach is about 7 miles away, making it more difficult to access, especially with the traffic in this area. One option I found is Neighbor Care Health, which has clinics in Rainier Beach and accepts both Medicare and Medicaid. For change at the community level, I would recommend engaging with the Rainier Beach Action Coalition, which focuses on access to education, wages, and overall improvement in quality of life for members of this community. I believe they would provide a wonderful platform to raise awareness of the importance for mental health in this community, particularly for those who are pregnant. Partnering with local clinics and providers in the area to educate them on the importance of mental health in their perinatal patients, and also provide them with a list of resources available both locally and nationally. We need to normalize talking about mental health in our community and teach children how to verbalize their emotions in schools and daycares. At the county level, Seattle is part of King County. One program offered on King County website was Women for Women was the Nurse Family Partnership, which involves partnering women who are pregnant with their first child with a registered nurse who provides education and assessment for pregnancy until the child's second birthday. They can help facilitate a healthy pregnancy and also ensure the safety and well-being of the child. I thought this was a fantastic program, and my thoughts for this would be to expand this resource and incorporate mental health professionals such as psych NPs and therapists. I would also want to provide additional education to registered nurses involved in this program on mental health. At a national level, I believe better access to mental health care is imperative. While strides have been made to increase access to health insurance in general, and behavioral health services in particular, there's still a great amount of work to be done. Only 60% of insured individuals say they have full coverage for behavioral health through their insurance plans. And furthermore, only 43% of psychiatrists accept Medicaid compared to 73% of specialists in other fields. This leaves a great number of individuals who have coverage through Medicaid and Medicare without access to care. In addition, the U.S. Census states that almost 10% of the population does not have any type of health insurance, which creates an even greater disparity for the most vulnerable populations. There is so much room for improvement in this area. The hard truth is that most decisions about healthcare come down to politics and money. What we need to happen is a shift in our approach to mental health in this country, to be proactive rather than reactive. Since money is a crucial factor in policies and politics, we need to educate our leaders at the state and federal level that preventative care not only saves lives, but also money. The Center on the Developing Child at Harvard University states, The basic principle for neuroscience indicates that providing supportive and positive conditions for early childhood development is more effective and less costly than attempting to address the consequences of early adversity later. Policies and programs that identify and support children and families who are most at risk for experiencing toxic stress as early as possible will reduce and avoid the need for more costly and less effective remediation and support program down the road. And then I found a great quote that was, "Medicine is the social science and politics nothing but medicine on a grand scale," by Rudolf Virchow in 1848. So that was my presentation, and thank you very much for listening.